Okay, so today's lesson is cardiovascular disease, which can be called atherosclerosis, it can be called peripheral vascular disease, and it's very important that you understand this because today's cardiac lecture is going to really point right back at the basis of atherosclerosis. Now, I want you to see this blood vessel. It's clean. There's no red or yellow around the opening there. Imagine red blood cells moving through, doing their little red blood cell dance. This blood vessel, we're going to say is an artery, and we'll say this is you in the newborn nursery because you were completely clean with no plaque, no atherosclerotic plaques anywhere in this vessel. It's just a wonderful, wide vessel that lets blood flow through. Great circulation. Now, let's take you to college. This is you in college. This is pizza. This is your wings. This is you sitting for hours playing PlayStation. This is you kind of having a diet that mom would not approve of. This blood vessel is starting to build plaque right around there. This wonderfully clean vessel is going to become more narrow. Perhaps you picked up a habit in college, like, shall we say smoking. We won't say smoking what? We'll just say smoking. Every time you smoke, this blood vessel gets narrow for 1 whole hour. Okay, let's move on in life. Let's look at this blood vessel, which has an incredibly narrow opening. Certainly the very first blood vessel that I showed you, my finger could go straight through with no problem. This blood vessel is you in your 30s and your 40s. You have a sedentary lifestyle. You are sitting on the couch waiting for Empire or Scandal to start. You have gotten really accustomed to fast food every week, if not 3 to 5 times a week, which is average for Americans. You now smoke a pack a day. So there's 20 cigarettes in a pack. There's 24 hours in a day. Every cigarette is 1 hour of vasoconstriction in which this little lumen gets even smaller, making it very difficult for blood to circulate. You have also picked up on, shall we say, taking the elevator to the 2nd floor, or kind of fishing for half an hour at Walmart for the best parking spot, the one by the door, or driving to the curbside to get your mail, maybe going up the street in your car for the football party. That's just how you do it. This lumen, or area where blood needs to go through, is so narrow that you might start having leg pains when you walk. Maybe you're having some chest pain. Maybe the color of your skin below the waist is more pale or paler. Maybe if you're a gentleman, the hair on your legs is not really there as much anymore. Perhaps you're cold more than you're warm. And then we're going to move on into your 60s. If you'll just look at the newborn nursery blood vessel and this one, there's a drastic difference. There's a red clot blocking all blood flow through that blood vessel. So if you consider that this cardiovascular disease takes years to develop, it will make sense why almost everything we're going to talk about today develops